The continuum surface table is a flexible solution for hospital and in-home care. Typical overbed tables used in the hospital setting are difficult for patients to maneuver while in bed. While the extendable tray table is intended to give patients more room for their belongings, it frequently inhibits movement and places objects farther away from the user. Raising and lowering the overbed table can be particularly difficult for users with limited strength and mobility. The continuum surface table provides both nurses and patients with a surface that is both useful and engaging. Patients are able to manually conform the table to suit the needs of their daily activities. For example, patients who frequently read are able to prop the book on the back side of the table by folding the back of the table up, or on the front side of the table by folding the table down, depending on where they would like to position their book. The surface of the table is rigid enough to be pressed on while writing. The table can even be molded far enough to conform to odd-shaped objects like a bowl. Because objects can be fitted into the table, it can prevent them from being knocked over. Storage boxes in the table provide spaces for small objects that are frequently lost, such as chapsticks, pills, or even forks. Because of the continuum table's cantilevered side, it can be swung out of the way to accommodate the needs of the nurse or maneuvering the patient into and out of the bed. When under normal pressure, the table is initially flexible, but when vacuumed becomes rigid and supportive. The table surface was built using a bag designed to support negative pressure as well as styrofoam beads from a bean bag. Steel conduit tubing was bent into a U shape using a tube bender. The table surface was supported using Bosch square tubing, and acrylic was used for the end pieces of the table. Last, the boxes were installed and the table was painted.